I've started that. Okay, so as I told you all before also, the main role of a physiotherapist is you make sure that these children are achieving their milestones on proper time, and all the trick movements that we just now discussed, or all the things which are deviated from normal, you try to get the baby to as normal walking pattern or as normal movement pattern as possible. Many a times you will notice that these children, when they stand also, if you ask them to do sit to stand, they will stand with a hyper extension at their back. Okay, and their legs, they are also always in hyper extension. So this pattern has to be corrected. Okay, so your role as a physiotherapist is making sure that they develop a uh, normal pattern of movements. Okay, and making sure that they achieve the milestones on proper time. Okay, so here mainly in Downs, what is important if the baby comes to you in the initial stage, first 1 or 2 years of life, is your NDT techniques. And if you're getting to see the baby in later stages, it will be mainly strengthening and making sure that they have a good stamina. Okay. Let's go ahead and I'll just again revise the basic features of Downs that you will see. See, we will, as I told you all, first there is broad flat face, slanting eyes, epicanthic eye fold. Someone said na that the eyes are shallow. So it's actually called as epicanthic eye fold, and they will have a short nose. They will have abnormal ears, as I think Ranjit said, they will have flat back of their head. There will be many loops on fingers and palm creases. Okay, here as you can see, they will have short and broad hands. See, what is this is something which is important. Small and arched palate, okay, big and wrinkled tongue, and dental anomalies. All this combined is going to lead a child with Downs to have a small mouth oral cavity, okay, because the tongue is big and the palate is small. So that is why, because of this disproportion, many times the children with Downs do not develop speech properly. One, and they will have that, their mouth always remains open, or they have drooling of saliva continuously. The reason is this, that because that there is disproportion of the tongue and your oral cavity. Okay, so you have to take care that this drooling of saliva is reduced to certain extent. Okay, and because this tongue is so broad, they have difficulties in speech also. That is why speech therapy has to be started as early as possible. You can also show some exercises for speech that we will discuss later when we discuss the management. Okay, but you should understand why they have this drooling, which is because of disproportion of your tongue and your oral cavity. Okay, getting it? See, now another things like diminished muscle tone, again it is important for us. Big toes and spaced toes, which is also called as saddle gap. Okay, so why this happens, because the baby is trying to increase the base of support. So if you increase the area of your foot, the base of support will increase, right? So in an attempt to do that, this kind of anomalies, they increase in the babies. I won't really call it anomaly, but this type of structural changes happen in these babies. Now rest of the things like congenital heart disease or entangled colon or umbilical hernia, all this can be there in the baby, which will be detected generally when the baby is born. Because when the child is born, a thorough screening of these babies is done. Okay, and then generally these problems are detected. So once this baby is stable, you can start with physiotherapy for these babies. Okay, are you all still with me? Yes, no.
Yes, ma'am.
So, do you know what are the causative factors or reason for someone to develop Downs?
trisomy of 20.